Hi, this is Terry Ladd. This is Spotlight Review Week number 4. The article that I read and researched is called Preventative Care for People Experiencing Homelessness. The targeted audience is community health centers, primary care physicians, public health nurses, and home care nurses. A little bit of a background is that the healthcare for the homeless actually started back in 1985 as a program of the Robert Wood Johnson Foundation and the Pew Memorial Trust. The most recent data in 2005 shows that over 890,000 people are served each year through the 295 federally funded health centers. Homeless people have a great need for home care. People experiencing homelessness experience lower life expectancies and higher prevalence of many diseases. It is estimated that the average life expectancy for people experiencing homelessness is between 42 and 52 years of age. That's compared with 78 years in the general public in the United States. Individuals experiencing homelessness have high occurrences of infectious disease, substance abuse, and mental health issues. All of this which is related to and made more difficult by the lack of access to housing, regular medical care, health insurance, nutritious foods, transportation, employment, and some other factors. Key points of this article is that early screening is very important because if the diseases are caught early enough, treatment can begin, reducing the impact of the disease and potentially curing it or mitigating symptoms and complications. There are actually 3 levels of preventative care. The primary preventative care aims to prevent the occurrence of the disease, for example, with your vaccinations. Secondary preventative care prevents complications from a disease that has developed or detects the disease before symptoms occurs. An example of that is mammograms as a form of early screening for breast cancer. Tertiary preventative care occurs when the disease and conditions are already present, but the clinician is focused on reducing the impact of the disease, thereby preventing further deterioration, morbidity, and mortality. An example of tertiary preventative care would be cardiac rehab for someone that has been diagnosed with a cardiovascular disease. A group of clinicians and healthcare providers generated list of screenings that clinicians should consider using when they're caring for people experiencing homelessness. The first list of screenings is called Screenings for Health Conditions and Diseases Common in People Experiencing Homelessness. Some of the screenings that they recommend is for HIV, hepatitis C, TB, cancer, cardiovascular disease, tobacco use, traumatic brain injury, diabetes, hypertension, foot problems, low bone density, oral health problems, and vision problems. The other type of screening is mental and behavioral health screenings. Clinicians should look for substance abuse, alcohol use, depression, anxiety, suicide tendencies, adverse childhood experiences, post-traumatic stress disorder. The safety and living condition screening includes looking at housing, intimate partner violence, any other forms of violence, including human trafficking, nutrition and food security, weather-related injuries, environmental injuries. The last list of screenings is your immunizations, which is for Hep A, Hep B, influenza, the Tdap, meningitis, zoster, the pneumonia vaccinations, HPV for youth, and any other recommended pediatric vaccinations because sometimes homeless children are never receive any of their vaccinations. So in conclusion, clinicians who work with patients experiencing homelessness agree that realistic and effective care plans should account for the patient's personal situation. You have to look at factors like their living conditions, level of motivation, and material constraints. A patient's top health priority may be actually different from the healthcare providers. and compliance will depend upon the provider's willingness to listen to the patient and understand the situation of the patient and the reality that he lives in. My opinion of this article is I'm very supportive of the movement for the healthcare for the homeless. And after researching this article and a few others, I'm more aware of the issues and struggles of the homeless population. This article provided excellent insight regarding adults who are currently or recently homeless and what they experience and how that can lead to earlier onset of certain geriatric conditions. This article also provided research that at least 50% of people experiencing homelessness have significant mental health and substance abuse issues. And that was really good information for thought. I hope you enjoyed my Spotlight review. Thank you very much. Hi, this is Terry Ladd. This is Spotlight Review Week number 4. The article that I read and researched is called Preventative Care for People Experiencing Homelessness. The targeted audience is community health centers, primary care physicians, public health nurses, and home care nurses. A little bit of a background is that the healthcare for the homeless actually started back in 1985 as a program of the Robert Wood Johnson Foundation and the Pew Memorial Trust. The most recent data in 2005 shows that over 890,000